Okay.
Thank you very much for coming. Thank you, Mr. Hello, everyone. Nice to see you all.
Ick. Young.
Very young. And I will tell you that I apologize for bringing up conditions in New York City during this, but in light of my brother's death, I must tell you that we have. I know you know this, but from personal experience, the overcrowding in the emergency rooms is insane. He was there for 73 hours.
It's going to get worse with the health care bill and with the governor's cutbacks, because the governor's cutbacks, which he may not have any choice in all fairness to the governor, but there'll be less money. Some of these small hospitals will close, some of these other programs, and people will come to the HHC hospitals. And that's, you know.
They'll be there for days in these emergency rooms.
Well, they try to decide what things they can fix right away and what things they can't fix right away. You know, if you're bleeding, they'll stop the bleeding. If you need an X-ray, you're going to have to wait. That's just, all of these costs keep going up. Nobody wants to pay any more money. And at the rate we're going, healthcare is going to bankrupt us. So not only do we have a problem, it's going to bankrupt us. And we've got to sit here and say which things we're going to do and which things we're not. Nobody wants to do that. You know, if you show up with prostate cancer and you're 95 years old, we should say, go and enjoy, have a nice cream, lead a long life. There's no cure, and you can't do anything. If you're a young person, we should do something about it. Society's not willing to do that yet. So we're going to bankrupt us, and we're not looking at prophylactic care. We're not trying to take care of things so you don't get sick. Nobody ever says thank you for keeping you from getting sick. They say thank you if you're sick and we cure you. If you look in Europe, we spend here about $7,000 odd per person per year on health care in the United States. In Europe, it's about $3,300, less than half. They have a life expectancy 2 or 3 years greater. Now, in New York City, in all fairness, life expectancy is now a year better than in the country as a whole. And it's up a year and 7 months in the last 9 years. It's because of reduced smoking makes a big difference. Lower crime rate makes a big difference. Faster response time fire engines, better traffic signs. Closing Broadway saves a lot of lives. It's one of the highest pedestrian fatality neighborhoods in the city. Because people of the sidewalks couldn't handle it.
I never realized the benefit to closing Broadway till now.
I'll give you another benefit.
And I was walking with him one day.
And I was going crazy.
I'll give you another benefit. Retail, and this is you'll appreciate this because it's a real independent measure. Retail rents, ground floor, Times Square, Herald Square, have more than doubled in the last year. Because the commerce is so great. Before you were just driving through, you couldn't get out to go shop. For the stores, it is a godsend. And incidentally, traffic in the city is better. Now, it's a little bit hard to measure, but the way you measure traffic in the city is anytime you get in a cab, guy throws the meter, sends a signal with your location and start, and we're in. So you can take a computer and you can go through the millions of trips and find out how long it takes to get from here to here in the real world. Not one guy driving it, but the way cab drivers dive around traffic. Sometimes they make mistakes, sometimes this, sometimes that. And it is much quicker, not much, somewhat quicker to get around the average trip. And you do it for the east side and the west side, because if the economy is better or worse, or the weather is better or worse, that could influence it. But both sides of the city have the same economy, both sides of the city has the same weather. And so it's a ways to really measure. That has been a very big success in terms of somewhat improving traffic, enormous tourist draw around the world. The reason you have 48.7 million tourists is things like that. People love those things. At 11 o'clock at night, it's mobbed. There's a store, Forever 21, in the middle of Times Square. Maybe it's Herald Square, one or two. The guy, a Korean guy, owns a store. He gets something like 50,000 people a day in his store. He's open from 8 in the morning till 2 in the morning. Women buy, young people buy dresses. $25, $35. There's an enormous demand, and this is a godsend for the city. But it reduces traffic deaths, all the health stuff, that all adds up.
With what you said about the emergency rooms, when you go to Washington, do you let them know that you're against the health care bill?
I phrase it that it's not addressing the two issues. Number one, it's going to bankrupt us, and number two, Europe seems to get more for their money. They say yes, and then they go back to taking care of every special interest. And it'll be fascinating to see what happens with the governor's Medicare cuts, because he put this committee together that's got to decide where to save money. But the hospital owners and managers are there. They don't want to reduce their hospital cut. And the people that work there don't want to. And those people that provide prophylactic care, different group of people. Anyways.
So you're not actively working to repeal it?
You know, I think the Republicans will unfund it. Having said that, you still need some solutions. And saying no is not a solution. So I'm not, you know, some stuff I don't like, but just being against everything is Meshuggah as well.
So what is the solution to the emergency at the end of the day?
You have to put some more money into emergency rooms, but you have to fix, there's two solutions for that, but for most of the medical things, both cost and why we don't live longer. One is fix the immigration laws, because we have doctors, they train here, and then we don't give them green cards. In the middle of, it's easy here, middle of the country, you can drive 2 hours to get to a doctor, because all those doctors who are willing to go there, you know, a young Pakistani doctor probably not going to make a living here. He'd be welcomed in the community because they need a doctor, and eventually they'll accept him. You know, they'll invite him to dinner because he saved their lives, and then he'll meet other people, and he becomes part of the community. They're not there. So if you have a stroke, the next 5 minutes is critical. 2 hours, forget about it. I mean, if you have a broken arm, it doesn't make any difference. So one thing is fixing immigration, and the other,
they should be able to live here.
yes. I mean, anybody that gets a graduate degree in America, give them a green card. What, are we crazy? The rest of the world is desperate to get these people to come there, whether they're creating businesses, or they're scientists, or Indian chiefs, or doctors, or whatever they are. They get a graduate degree, give them a green card. And the other thing is tort law. First thing you should ask your doctor is, do you give every test known to man? If the guy says no, say, you're stupid. Because your whole livelihood, the ability to support your family, some stupid jury is going to take away everything? You got to be crazy. Just do it. What? And that balloons the cost and ties up the emergency room. So you want to know 2 things to do, concrete things you can do. Are we going to do either one of them? Kind of hard to see, guys.
What about putting money into emergency type rooms for preventive care as opposed to aftercare?
Well, nobody wants it. The Post writes a nasty story, you know, that it's a nanny gate when I try to stop smoking or try to stop you to eat salt. Now all of a sudden the federal government's in favor of it now, and Michelle Obama. The biggest problem you have here, it's growing, is obesity. And you look at the kids, and you know, if you go north of, the last state health commissioner wrote a great column. I never met him before. I called him and said, thank you for writing it. If you go above 96th Street on the east side, you cannot get fresh vegetables, you cannot get diet drinks. Every billboard's for full sugar drinks, which is just a disaster. You go, and you look on the street, a very big percentage of kids are overweight. You go south of 96th Street, the reverse. Even small stores sell fresh fruits and vegetables, 2% milk, diet drinks. You know, there's no billboards advertising full sugar drinks. The parents won't let them eat it. One full sugar drink is 10 teaspoons of sugar. You could not drink a cup of coffee or a cup of tea with 10 teaspoons of sugar in it. It just, so.
The poorer the community, the worse people eat.
That is correct. That is correct. It's the same thing with smoking. The cigarette companies are directing their advertisements at poor people. And if not here, poor people are uneducated around the world. Half the smoking in the world is Russia, China, India, Bangladesh, and Indonesia. And smoking this century will kill 1 billion people. Anyways, I gotta go. Sorry about you.